My name is Claudia Sebastian, and I'm here to help you and your family live happy and healthy with asthma. My goal is that you and your child will know what asthma is, what can trigger their asthma attacks, and what medications are helpful in treating your asthma. With the help of an amazing website called Iggy and the Inhalers, I've got some great information to help you learn how to stay healthy. Asthma is a chronic disease. It's characterized by overactive airways, affects over 25 million patients in the United States, resulting in 2 million emergency room visits and 500,000 hospitalizations annually. It is a narrowing of the bronchioles in your lung, causing shortness of breath, cough, chest tightness, wheezing, and increased respirations. Here's our first site of Iggy and the Inhalers. You have these handouts, and you've also got the website to go to for future use. These talk about the different types of treatments that you can do and shows you what those treatments will do. It shows you how when you're not feeling good and you're having that asthma attack, taking that inhaler can help you feel better and move on with your day. We've got two main areas of treatment, long-term and quick-acting. By utilizing a long-term treatment such as Flonase, Qvar, Singulair, or Symbicort, you can decrease the number of asthma attacks that you'll have. If an asthma attack happens, the use of a quick-acting, such as albuterol, Ventolin, Xopenex, or Atrovent, it can help you stay home and not have to go into the hospital. In addition, your physician could order a dose or doses of oral steroids or steroids that you can take by mouth. If these don't work and you end up going into the hospital, you may find that you're going to be put upstairs in the ICU or on the floor with a continuous dose of albuterol in addition to IV medications, IV steroids. Let's take a look at two of our asthma treatments, fluconazole and Xopenex. These medications are one of each type. Our Flovent is our long term. So it's an antihistamine, it's a steroid. It decreases allergic reactions, preventing that nasal congestion, the sneezing, the runny nose, the watery eyes. You have 86 different drugs that interact with Flovent. Amoxicillin and Cipro are a major and a moderate medication that are used often in children with infections, and they can increase the absorption of Flovent. Erythromycin is a medication that can actually decrease the absorption of Flovent, but that has more of a minor effect than the other two medications. It is not something that can be utilized for treating a child under the age of 4. And it costs about $16 for 16 grams. Xopenex. Xopenex is what we call an adrenergic bronchodilator. It relaxes the muscles in your airway. It lets you take those deep breaths that you need. There are 674 medications that interact with Xopenex, however. One of the major ones is a medication that we utilize if your child has some kind of a sedation being needed. It reduces the effectiveness by shrinking the bronchioles. So your bronchioles are small. We give the propranolol. It decreases it even more, and we find that we're not as effective when we're trying to get that Xopenex to open it up. Pseudoephedrine, which is a moderate interacting medication, can increase your cardiac side effects. So you can cause an increased heart rate. Also affecting the heart rate is prednisone, which is a minor reacting medication. It is a medication that is often given when patients have asthma. Again, this medication is not approved for children under the age of 4. and it can cause rhinitis, tremors, and a fast heartbeat. But our goals with both of those medications are to treat or prevent those signs and symptoms of asthma. So, what are those things that can trigger asthma? Pollens, molds, hair, dust mites, exercise, colds, or smoking. So it's very important to maintain a healthy child. It's very important to keep your child out of being exposed to cigarette smoke. Be very cautious in where you're going with your child. Be very cautious in what you're allowing them to expose themselves to. There is a study that showed that age of the parent, low income status, minority status, and education, low education, are all contributing factors to being an appropriately or to controlling appropriate the asthma. The main reason behind that is if you don't have the finances or don't have the knowledge that's required in learning about asthma and how to take care of yourself when you have it, it causes these children to not have the follow-up that they need. The first thing that we look at when you walk through the door in the emergency room is we look at your vital signs. We take a look at your labs. We look at your x-rays. These are diagnostic tools that help tell us what's going on with your child. It helps to tell us, do we need to just do a treatment and send you home? Or do we need to send you upstairs on a continuous dose of albuterol or a continued repeated IV steroid? And again, we've got Iggy here pointing out those possible triggers for an asthma attack in a kid-friendly way. So, as we said before, asthma is a diagnosis that affects millions of children in the United States every year. The reactions of these children with asthma is anywhere from a mild reaction all the way to a severe reaction that can actually cause death. So it's very, very important if you know that your child has asthma to have them treated and have that taken care of. Keeping your child healthy, keeping them away from smoke exposure, knowing what their triggers are and keeping them from being exposed, keeping up with your physicians, getting those appointments, getting those medications that they have scheduled. All of these can decrease your chance of having asthma attacks, of having a possible horrible complication in having that child die from an asthma attack that could have been prevented. What we have found is by doing an asthma action plan prior to your discharge from the hospital, we are able to help you help your child. So guys, take a look at that asthma action plan that you have there. What kind of medications are you going to take, whether you're feeling good with your asthma or feeling bad with your asthma? What kind of medications do you need to add into your daily medications if you start feeling sick? And when is it important that you get yourself into the hospital? Get your mom to take you in. Take your child in. Don't take no for an answer. All of those things are addressed in that action plan. So some of the main questions that we get are, what are the signs and symptoms of asthma? Who can tell me what we have? Very good. And what kind of treatments do we choose normally for people with asthma? Yes, very good. And what are some of the environmental risk factors for children with asthma? What are those triggers that we have out there? Definitely. Well, I am hoping that you guys got all the questions answered that you need, that the handouts that you have here will help you in living a healthy, happy life with asthma. And please finish the evaluation and the test before you guys leave today. Have a great day.